Good afternoon. Peter Goertz. I'm a psychiatrist. So you're in high school or college and you're fascinated by psychiatry, psychology, and you're thinking of becoming a psychiatrist and you want to do comprehensive treatment. You may want to prescribe medications, but you also want to do psychotherapy. Is that still possible in today's world, in today's medical system? The short answer, in my opinion, is yes, especially in private practice. And unfortunately, it's a lot less common now that psychiatrists put a lot of emphasis on psychotherapy. But in the past, it was very common. And one example is the psychiatrist Milton Erickson. And he had a very original, creative approach, apparently. And from what I recall, with one patient, for example, the patient came to him complaining of insomnia. He just could not sleep. So Dr. Erickson told him, do not sleep. And apparently by doing that, the patient then, of course, fell asleep, by trying not to sleep. So the human mind is fascinating, and there can be various approaches, creative approaches. So our current medical system generally focuses on psychiatrists prescribing medications, but if you're motivated, you can still do psychotherapy. And even if you're just prescribing, there's going to be some psychotherapy involved. So it is possible, especially if you really focus on going in that direction and making sure you have some psychotherapy patients. Now, today in residency training in psychiatry, there may not be as much emphasis, and there may be some variety, of course, between programs, but there may not be a whole lot of emphasis on psychotherapy, at least not as much as there used to be. I still see patients for psychotherapy, unfortunately, usually not more than monthly, unless there's some kind of crisis. And almost all of my patients who I see for psychotherapy are on medication. And for me, it's wonderful to see people for psychotherapy because I enjoy doing that, and you want to be satisfied in your job. Job satisfaction is crucial. You're going to be doing this for 40 years, maybe more. So if you don't enjoy it, that is a real problem. And that way, if you do psychotherapy, if that's something you enjoy, you don't feel like just a pill pusher. And I'm not saying you have to feel like a pill pusher if you just do psychopharmacology, but you might if you miss doing psychotherapy. And that way, from the patient's perspective, there's, so to speak, all-in-one shopping. So there's one-stop shopping, and the patient just has to go to one person. And that makes it simpler for the patient. And also, sometimes it can be a little tricky to communicate with a patient's psychotherapist. So if they don't see a psychotherapist and you're the psychotherapist and also you're the one prescribing, there is no need to communicate with the psychotherapist, and that way there's no potential difficulty with doing that. I'm not saying it's always a problem. Often communication with the psychotherapist is fine. So that way of doing things is fine also. And it, to a large extent, depends on, well, availability, but also the patient's preference, your preference. And there are some situations, though, where it's really an advantage if a psychiatrist does psychotherapy. For example, if a patient has serious medical issues or substance use issues, a psychiatrist may pick up more easily on medical issues potentially causing psychiatric issues, or substance use issues or substance withdrawal potentially causing psychiatric issues. So there can be real advantages of doing psychotherapy as a psychiatrist, both for you, if you enjoy that, but also for the patient and for the patient's treatment. And there, like I said, there still is that option. especially if you go into private practice, but also if you work in a clinic, you just want to make sure you carve out that time as best you can. Thank you.